Um, are people joining us? Okay, so some of you had pinged me about this question on inferior rectus muscles action. So let's take a look at that question. Now, before I even talk about that question, what are the actions of inferior rectus? The primary, secondary, and tertiary actions. Because the primary, secondary, and tertiary actions themselves are very, very important questions. So, if you talk about the right eye, okay, so let's consider this as the right eye. And we've got inferior rectus, which is getting attached like this. So it comes from the annulus of Zinn, the inferior rectus muscle. So there's a question on inferior rectus which we are discussing, guys. So it is attached close to the limbus. So the primary action of inferior rectus is depression. Okay, depression is a primary action. The secondary action is extorsion. Okay, the upper pole of the eye rotates outwards. That is extorsion. The tertiary action of inferior rectus is adduction. So the primary, secondary, and tertiary actions of inferior rectus are depression, extortion, and adduction respectively. Now coming to the question that I had actually given in the Telegram quiz. When the eyeball is abducted 23 degrees, the inferior rectus acts purely as. So what you need to understand is when I'm talking about primary, secondary, and tertiary actions that I just told you. So when the eye is looking straight in primary position, when the eye is like this and the inferior rectus is going to act, there will be primarily a depression, a little bit of extorsion, and a tad bit of adduction. That's what it means. The least amount of action would be adduction. That's what it means. Now the question in particular asks, when this eyeball is not in primary position but it's slightly abducted, kitna? 23 degrees. Now what would be the pure function of inferior rectus? So for this you need to actually understand the inferior rectus anatomy. So the inferior rectus, hi Shubhajit, hi beta. So the inferior rectus actual anatomy, when it comes from the annulus of Zinn in the apex, it's slightly like this. Okay, it's not straight, it's slightly like this on the lateral side. So from the axis of the eyeball, it's 23 degrees away. Yeah, so there's slight angulation, right? So that is why you get the extortion. Yeah, that's why you get primarily a depression, little bit of extortion, and a little bit of adduction. Now, when the eyeball is going to abduct 23 degrees, that abduction is going to be because of lateral rectus, not because of inferior rectus. So I'm reading on the question from Telegram's quiz today, the third question. When the eyeball is abducted 23 degrees, when this eyeball, the inferior rectus is slightly like this, no, lateral side, this is the right eye. And the eyeball is abducted slightly 23. What is the pure action of the muscle? So now the eyeball and the muscle are aligned, perfectly in alignment, and it's attached a little close to the limbus, right? So now when it pulls, I'm sorry, I'm talking about the inferior rectus, I should have kept it here. Because superior rectus also same 23 degrees. Okay, so inferior rectus, annulus of Zinn, and slightly lateral. Okay, slightly lateral. So what was I saying? So that is why depression, extortion, and a little bit of adduction. Okay, maybe I'm sleepy, nah? Okay, right. Yeah, so now my eye is abducted 23 degrees, and now it's going to be a purely depression moment. So there's no more extortion, no more adduction component, because the eyeball and the muscle are parallel to each other, perfectly in alignment to each other. Is that clear? So the answer to this particular question was it's a pure depressor. So when you have to actually check the muscle or the action of inferior rectus, the pure only inferior rectus, you ask the patient to abduct a little bit 23 degrees and then ask him to depress. If he's able to depress the eye, then inferior rectus is perfectly working. All right. So now there's another question that I wanted to discuss in regarding today's question. Yeah, the last question. Okay, because INICT is coming and this question is very important. So patient presents with right hypertropia and right head tilt, and which is increasing on left gaze. So this you need to use the Park's 3-step test. So I'll explain the concept for you. So when it is hypertropia, the right eye is hypertropia. So among both these eyes, now the right eye is a little up. Yeah. Now, why is the right eye is little up hypertropia is because the depressors are not working. Which are your depressors? Just now I discussed about inferior rectus, right? So inferior rectus is a depressor and superior oblique is a depressor. Inferior rectus is a depressor in abduction and superior oblique is a depressor in adduction. So either of these muscles are paralyzed in this eye, that the right eye is hypertropic, or it could be the left eye is actually hypotropic. But whatever, the question says right hypertropia. So either these depressors are not working, that the right eye is up, or the left elevators are not working, that the left eye is down. So either way, you're going to say right hypertropia. Is that clear? Yeah, are you following? All right. Now, they also told us that the patient is presenting with a right head tilt. So when he has a right head tilt, it actually means his squint is least in the right head tilt. So in Park's 3-step test, we need to use the components where the squint is increasing. So when you go to the third step, see, first step you will use the eye in primary position, so right hypertropia. Second is the lateral gaze, so the squint is increasing on the left gaze, so we'll use left gaze. Now for the third step, you'll have to use the head tilt. Now which side head tilt will you use? You will use a left head tilt, because in the question it says the patient presented with a right head tilt. So if he's already having his head tilted towards the right, it means his squint is the least. But in Park's 3-step test, we need to use the position where the squint is increasing, squint is maximum. All right. So now use this very simple technique. Okay. So when I say right hypertropia, this eye is up, right eye. I think it's laterally reversed for you, but just follow with me. Follow me. So right hypertropia. So when I have a right hypertropia, the right depressors are not working. Okay. So right depressors and left elevators. So I think it has to be ulta that I have to show you if you have to understand my right and left. So I'll keep it like this because it's laterally reversed for you. So right hypertropia. So my right depressors are not working, that the eye has moved up. So keep your finger like this. So automatically the other eye, you keep your finger along the superior orbital rim. Don't think much, just do this, right? Now they say left gaze. So just pull your finger, trace your finger along to the right side. So now your fingers are pointing at 2 muscles. Now don't even worry about which 2 muscles. Now let's go to the third step. We've already used left gaze. So we've just slid our fingers to the left side. So we held it like this. So now I slide it to the left side. Yeah. Now for the third step, we have to use the head tilt. Now which head tilt? Left head tilt. So left head tilt on the left side, what exactly happens and what you should look for? See, when you do a left head tilt, the eyes are rolling like this, but there will be a counter rolling mechanism. So the right eye will intort and the left eye will extort. For all of us, it has to happen. So when I tilt my head to the left, the eye will tend to tilt, but I need a counter rolling mechanism. So my right eye will intort and the left eye will extort. Yes, this has to happen. So now, always, whichever head tilt you're using whichever side you're using on the third step, so that side you look for intorters. So that means this is for you. Now this is the left side. As you're looking at me, my image is laterally reversed. So on my left side, I have to look for intorters. Which are my intorters? And already my fingers are pointing here. Which are my intorters? Intorters are your sin, superior rectus and superior oblique. See, superior rectus is an intorter and superior rectus acts as an elevator in abduction. Yeah, elevator in abduction. It takes the eye here. Superior oblique is a depressor in adduction, in an adducted eye. Yeah, so superior oblique would be here, but my finger is already pointing here. Yes, so one finger is here, one finger is here. So on the left eye, the finger is pointing at the superior rectus. So left superior rectus. So left superior rectus is your answer in this question. So patient presents with right hypertropia. So right hypertropia. So the depressors are not working on the right side or the elevators on the left side, and the squint is increasing on the left gaze. Slide your finger to the left. And for the third step, now in this case, patient was presenting with the right head tilt, which was his comfortable position. So you don't use that. You use a left head tilt for the third step. So left head tilt means on the left side, you look for intorters. The intorters are your superior oblique and your superior rectus. Your fingers already pointing at the superior rectus on the left side. So your culprit muscle is left superior rectus, as simple as that. Because INI-CT is known to ask this question invariably. This question, Parts 3 step test comes. So that's why I give you always this no paper, no pen technique, because in the exam you have no... you don't have so much of paper to waste for this one. Yeah, you might have some physiology or pharmacology, some problems, numerical problems which you might want to solve, and you don't want to waste it for this simple one which you can do with your finger technique, ungli wala technique. So watch this again, and I will also share the other detailed video that I've done on this Parks 3 step test, no paper, no pen technique. So follow that. And guys, this question is definitely coming in INI-CT, and even if it is not coming in exam, it's fun learning this. Okay, so 2 questions I've explained. I hope you found it useful. Any other questions, bache? You have any other doubts regarding SQUINT that you want me to explain? If there are no other doubts, then you can join in the discussion on the app. It's a free discussion, so you can join on the app. Just put on the chat box on the app that you want access to the Telegram quiz discussion. You'll be given access on the EyeMentor Dr. Rajarathna app. All right. Any other questions in SQUINT? I guess you all are so tired. Any other questions in SQUINT? Any doubts? SQUINT, strabismus topic. I hope all of you know strabismus and SQUINT mean the same thing. Do you have any doubts here? Okay, so come up with doubts. If you do have any doubts, you post it in the comments. I'll explain to you. All right? Okay, good night. Or are you typing the comments? You're taking such a long time. In the meantime, I'm trying to shut the video. Okay, bye.